you. Can I start?
Thank you.
It will be a short talk, but this is going to be a combination between arts and science. Okay. I work in the field of neuroscience, where we deal with a lot of the physical structures of the brain, and now we can even proceed to doing surgery when a person is awake and doesn't feel the pain. So the elements of brain and most of the mysteries of the brain are more widely known now than it was before. Now, one of the foundation of ethical behavior we know is empathy. Empathy is a very big word, and once someone has this empathy in his mind, most likely his actions will be ethical. Because when he puts himself in the shoes of an animal, puts himself in the shoes of another person, then naturally he will understand about the other person, and naturally he will not want to do harm to these people. Okay? So what I'm going to talk about is there a seed of empathy in the brain? Is there somewhere in the brain that controls empathy? Okay. Now, previously people don't know that. People do not know about this issue, but for the past 10 or 15 years, the technology of magnetic resonance imaging, which is called MRI, or the functional MRI, where you can actually visualize yourself doing something. You're doing mathematics, and at the same time you can visualize where is the center of the mathematics. You're crying because of certain emotion, sadness. You can visualize where in the brain the sadness is coming from. So that technology of functional MRI and the MRI has made a very big understanding about the brain, and especially the deeper structures of the brain, which was unknown before, right? So, as I said before, the fMRI or the MRI has given a deep sense of understanding, and that is definition of empathy. And like I said before, when somebody understands the action of others, it will minimize unreasonable judgment of that person or of that being, and that misunderstanding is often the reason for creating conflict. Okay? So in any professions that we work, either you are a doctor, medical students, researchers, and so on, empathy is actually very, very important. All right? So I'll give you some examples of all these studies using functional MRI. In this particular, it's labeled E and F here. Here are the various centers in the brain. This study was done in 2014, where one person imagines his partner is sad. So just by imagining that his close friend is sad, certain parts of the brain light up. Okay, so this is through just imagining and deep thought or meditation, if you like. So you sit there thinking about your partner who is sad, and you at the same time you visualize your brain, certain parts of the brain lights up. Then the person was instructed to think of a stranger, somebody who's unknown to him, in a sad state. So the person sits and think about a person, a stranger, who is sad. And when you do the imaging, a different part of the brain lights up. So it looks as though it's a very complicated. When you think about your own partner, some parts of the brain lights up. You think about somebody else, another parts of the brain lights up. So these are sensitivity of the brain in response to other people's emotion. And I think this talk will complement a lot about what the professor is earlier saying about meditation. There are very real organic bases in the brain where things take place. All right. Now, this is another study. Trying to look for, now I'm just showing you the picture because it's not very, very clear. But if you look at the green and the purple bar, this is a study where they look at bad persons, a psychopath, an evil person who's been put to jail, right? Now when this person was asked to imagine another person in pain, when he was asked to imagine another person in pain, they discovered that the center of empathy in him does not light up. But when he imagined himself in pain, suddenly the center lights up. So a person, a psychopath who doesn't care about people, who doesn't mind about people being killed and create suffering in people. When they do the test on him, they realize that the empathy center, which is supposed to light up, does not light up. All right. So there's something about him, something about maybe his upbringing, maybe his early experiences, maybe his training, maybe his genetics, maybe, that made it impossible for his empathy center to light up. Now this is a very, it can be a potentially dangerous finding, this, because imagine somebody is being sentenced to death, for example, because of a bad thing he has done to someone. Court decides that he should be punished for that. The lawyers can argue that if I do a functional MRI on my client, chances are that the empathy center is not there. So you cannot just punish him because of something organic. You see? So this has happened before, this has happened already in some parts of the world, where the lawyers argue that it is not his fault, because when you look at his brain, the center which is supposed to light up in empathy doesn't light up. It's not his fault. So these things are, can create a lot of confusion. Once people found this center for empathy. And similarly, there was also a functional MRI done on convicts. This was published in the Proceedings of National Academy of Science in 2013. They look at brain imaging of people in jail, people with poor self-control, people who are impulsive, with criminal tendencies and antisocial tendencies. 96 of these convicts have a significant blank in one area. And that area is an area in the brain, and basically there's a defect in that area. Okay. What I'm trying to allude to now is that, can that defect be reversed? Can we create empathy on somebody who doesn't have the empathy center, or whose empathy center just simply does not light up? Because if there are ways to do that, then maybe we can create, we can help people to be more empathic to one another. We can help people to be more understanding of one another, and perhaps the chances of misunderstanding that usually creates conflict can be minimized. All right? So far, what we know is that the seeds of emotions, we think that there should be a seed of emotion. Now we know it does actually exist. All right? And we also know that those areas that do not light up, or those areas which do light up, they do light up because of activities in that brain, because of blood flows into that brain. So the assumption is somebody who has been brought up in an environment where there's a lot of good things happening around him, where he experienced a lot of good things around him, where he was brought up in a culture full of empathy, for example, then maybe the chances of blood flowing into that areas will be much more. So the determinants of such behaviors, such empathy, will probably be enhanced either through nurture and also through nature. You are born genetically bad, but if you are brought up in an environment where there's a very nice nurturing environment, maybe the areas which was not meant to be there will get its blood supply and will be lightened. Okay, so the other issue that I think is very, very important, which has implication to our training, is that in pediatrics, where I am in, we are taught about the concept of brain plasticity. Now, the concept of brain plasticity is such that if a child is born and he has got a defect, say in one arm or one leg, which means that something has gone wrong with his brain, affecting one arm or one leg, through training, we call it early intervention program, there is every chance that that defect can be reversed, because the connections of the brain is such that there might be reversal of that. The brain has got a lot of potential to be plastic, if you like. All right. So based on this concept, which is well known, then perhaps it is possible to train someone. I'm emphasizing the word training. It is possible to train someone, either from young or whatever stage they are in their life, possible to train them to acquire some of the good traits which will make them more ethical in their life, judging from the brain plasticity concept and also from the nurturing environment that I spoke to you earlier. Okay, and the brain plasticity concept has not been challenged by anyone, because through observation in clinical practice we know that it does happen. It does happen. I happen to look after a child with a multiple handicap, with cerebral palsy, and we moved this girl from a very dry, non-stimulating environment to an environment where there's a lot of stimulation every day. People talking to the child, people playing with the child. I saw with my own eyes how the disability in that child reversed when she was 7 years old. I mean, she lives with us now, but the reversal is actually very, very dramatic, because what she couldn't do before, she could do now through all this very, very intensive input of stimulation. It is through the same argument that there is another observation which we notice in children. All right, this is this. We know that even a young baby who is born yesterday, and 1 week later, when someone speaks to that baby and opens the mouth in front of the baby, we know the baby's focal length is about 8 to 10 inches. But if you stay close to the baby and open your mouth, you can try this yourself. The baby will imitate and open his mouth. All right, and that indicates some wiring that could be trained even at that stage, 1 week old, 3 or 4 days old. The baby will try to imitate. By the same token, we know this happened too. Okay, we know that a child, we have done research on this. A child who sees someone close to him doing a certain act, in this case smoking, will have in his idea that this will be acceptable. All right, this will be acceptable. In fact, in our research, we asked a young child, "Are you going to smoke?" He said, "No, I'm not going to smoke now, but I will smoke when I grow up." You know, so because he associates smoking with a behavior of growing up. So all these things are clearly explained through intensive brain stimulation, through plasticity of the brain, and so on and so forth. All right. And in fact, when you go into that, when you go into the nurture environment, we know that the determinants of nature, what happens to the child's brain, may be determined to the factors that happens in utero when the baby is in the womb. When the baby grows up and becomes a tree, there are so many other factors that will influence his behavior through the physical changing of the brain. I'm going to show you this one, which is my favorite slide here. We know that when a baby is born, there are cells in the brain. Okay, and we know that when a baby is being subjected to intensive, fully breastfeeding for the first 2 years, we know that happens. We know that happens. But physically in the brain, there exists a lot of interlinkages between one cell to another cell in this manner. Now, why does that happen? That happens because as the baby feels the pains of hunger, the baby cries. Okay, when the baby cries, mother will automatically hold the baby, and the holding of the baby will give the comfort of holding. You know, that will stimulate touch sensation. The warmth of the mother holding the baby stimulates the first sensation, which is touch. All right. Then the mother will say, "Are you hungry now?" All right. That will stimulate the second one, which is auditory, right? Then if you care to observe a baby feeding on the mother's breast, this is quite fascinating, because whenever a baby is feeding the mother's breast, he will not see anything else focused except the mother's image, because it's 8 to 10 inches from the mother's breast, and at that focal length, that's the sharpest image a baby can see. So as the baby sucks, the first gush of milk is colostrum, which is very, very sweet. Immediately it will kill the painful sensation, and the baby will open the eyes. Okay, and normally when the baby opens the eyes, the mother will open the eyes and give a smile. All this combination of touch, sense of a relieving of pain, of the mother's hearing and of sight, for 2 years will lead to this. Will lead to all these very complex interconnection of the brain neurons, and that is why we know now that it is not. We do not know how. We know now why mothers who fully breastfeed their children have babies with higher intelligence than mothers who feed the children by using other alternatives than breast milk. This is the explanation, okay? The touch and the sensation and all the neurological stimulus that goes to the baby's brain as the baby is being fed. Again, it shows quite logically, and what this is expected, that there are physical changes happening, but these things were assumed before. We assume these things take place. But now with the functional MRI and with very complicated neurophysiology, we can see it happening in real life now. All right? Similarly, I'm not going to go into this in a very detail, but there are studies done in rats, between rats who have a low licking behavior to their young ones. The first group of rats are rats that somehow lick their young less, all right, compared to those rats with a high licking behavior. They noticed that psychologically, the rats who were brought up in an environment of low licking, the mother licked them less. They grow up in a certain high anxiety level, high corticosteroid level, high stressful environment, the products of these rats. Whereas rats with a higher grooming and a lot of licking behavior have a low anxiety level and so on. These are rat studies, but in human studies we also know now that a mother who's pregnant and gone through all pregnancy in a state of depression. There was a study done, I think it was probably published about 3 years ago now in the obstetrics journal, of a fetus who is subjected to a maternal depression throughout the most part of pregnancy. It's very clearly related now that at the age of 10 years old, that child is more likely to suffer from depression and behavior problems. Okay, so again, something biological that affects the brain through psychological input. All right. So, again, I'm just repeating this. The theory of plasticity, why plasticity happens and why certain things can be reversed, is now known to be due to this concept of neuronal reorganization. All right, the neurons reorganize themselves. When you have stimulation of the brain during breastfeeding, the neurons start to interconnect themselves, and then pruning and everything takes place at various levels of the brain. Okay, so previously we know that a lot of the factors determining brain health and mental health and behavior, we know previously that it was probably due to nutrition, good nutrition. All right. So nutrition is still true, but now we are adding another factor to it now, which is probably more important, if not equal importance, is the state of fetal environment and fetal development. All right. So this brings me to another concept, which is scientists are now working on. All right. The concept is epigenetics. Epigenetics is that maybe you are born, you are destined to have a certain disease from your genetics. All right. When you do your genetics, it looks like you're going to develop psychiatric disorder, for example, from a genetic abnormality. You have that abnormality. Now, scientists are researching now and say that why is it that some people who are brought up under positive environment, nurturing environment, even though their genetics is going to be bad genetics, all right, suddenly they do not develop the disease. In real life, we see cancer patients who are really belong to those group of patients with very bad prognosis. They have all the markers in their cancer cells to say that these cancer cells are going to be very bad. Suddenly those cancer cells disappear. All right. Now, I was in the States about 3 years ago in a big conference of the American Academy of Pediatrics, and the keynote address was talking about this. We have to find out why. We have to know this issue of epigenetics more and more now. Perhaps we should be looking at emotional intelligence. Perhaps we should be looking at a nurturing environment. Perhaps we should be looking at happiness index. Perhaps we should be looking at other social, psychological factors that will change the behavior of disease. And I think over the next 5 years, we'll see more and more publications coming into this in the area called epigenetics. All right, I think the Bhutan happiness index and all that will be becoming more and more scientifically proven over the next 5 years through looking at the brain structures and the technology we have now. All right, because it looks like it is not just the genetics, the nutrition, the calcium, the potassium, and all these make a difference to a person's life. But the nurturing, the environment, and all this that I've talked about play a big role too. And for those of you who wants to go into that, it is called epigenetics, right? The happiness and stimulation, nurturing family, and so on and so forth. It does change the actual cellular level. It does change the DNA composition, the DNA structure, and so forth. All right. So it looks as though, from what I've said so far, it is possible to train someone to be more. After all, that's what we do. We teach doctors to be good doctors because we want them to be good doctors. We want them to be ethical doctors. We want them to be ethical politicians, if there is such a thing. We want them to be good scientists and so on. To be good is what we train them to do. If they answer wrongly in the exam, we fail them because that wrong answer is a bad answer. So maybe what we should do now, maybe we should be thinking about new ways of training professionals. The new way of training professionals is probably looking through the neurodevelopmental perspective, looking through education that promotes empathy through early experiences, through subjecting them to real life experiences. Maybe we should really drastically cut down the number of lectures we give in the class, but expose them to the workplace environment. Maybe we should bring them to Philippines and stop all classes when there was a disaster in Philippines and bring all our students there and work there, because the power of them getting empathy and humanistic value will probably be more than them reading a thick textbook of humanity. All right? Maybe we should encourage more meditation and supplications before class, for example, so that when before class starts, maybe we should start with meditation or such like, Maybe we can get people of different faith and different background to have more dialogues and engagement. And I think because we know that through subjecting life experiences like that, the chances of the right areas of the brain being lit up is probably more than what lectures can give, more than what PBL can give, more than what all our traditional ways of teaching can give. But getting them on the street and be in the area or profession that they're meant to be. So I think, of course, many people have done this in the past. If you look at the training of doctors in the past previously, training of doctors have some religious inclination to it. Doctors previously used to follow the community leaders who are often religious teachers. They go with them to the houses and so on. Even Hippocrates swore by God, all right? Because there was a religious link to it. And these religious people are there in the community, understand people, and a trainee doctor follows his sifu and then see what his sifu does and acquire the skills, all right? Maybe less exams, all right, and less pressures of some of those sort, all right. So I started off by saying that we think it is logical. Then throughout the history, we know that with the advent of functional MRI, we know where the centers are, where all these various centers are, and we know that these centers can be nurtured, not just through nature, but nurturing environment does make a difference. And the plasticity of the brain makes it even more possible for these things to change. And I will end up by saying again that all this should have an impact on the way we train professionals and the way we train people in universities, in schools, and so on and so forth. If you like, there's a very good book, How God Changes Your Brain. This is written by Andrew Newberg. It's a good book. It's on Amazon.com. How God Changes Your Brain. It's he's a neurologist, Newbert, and he writes about physical changes that I've spoken about. How God changes your brain, and there are other references that you can have a look at if you're interested to pursue this more. Thank you very much for listening.
Thank you. We're open for questions. Yeah. Okay, we'll start with Uli over there.
Well, I just want to comment upon the meditation thing. My guru said that if one being mindful when at the moment of No, the moment, how do you call it? The moment of
Calamity?
No. The moment, the moment that the parents get together.
Yeah.
Being mindful at that moment.
Right.
If the father is mindful, the baby will be very
Exactly.
very
And
good.
that belief is also in the Muslim community.
Yeah, right. And also the mother too.
Yes.
Will be beautiful.
That's
Yeah,
right.
this is.
That's right.
Yeah, so you have believed that in your.
There is also in the Muslim belief that even in the Muslim belief at the time of in the first night, there are certain supplications that ought to be said, so that the act become more of a blissful act in a way. So it's similar to what you said, very similar.
Okay, Uli, please, next.
Okay, thank you, Prof. It was another excellent presentation. The big question is that considering how important empathy is, how can we gain empathy? And I'd like to share what I have learned in my activities. As I said on my presentation, that I've been running a shelter for stray cats. And I don't know whether it is empathy or not, but so by day to day, so I'm more care for the stray cat because I know how they suffer.
Yes.
How they suffer. So to me, I don't call it it's empathy, but what I help is based on what I see on the field. So for example, about 3 days ago before I leave to this event, I saw this very sick cat. So his head are suffer from tumor or migraine, something like that. So I knew that how people treat this kitten. They kick, they throw away. So I feel if I put myself if I on that position, what happens? So to me that if it is called empathy, can be gained by knowing how people or how other believe suffer. That's the first thing. And if we is it what do you think empathy can be gained by knowing or understanding the fact? And then the second is I've been running this center for about 3 years, and during that time my younger daughter, 3 years old, so she's the oldest, and then she sees what I've been doing, and then I didn't tell her see how to help stray cat, but she learned from what I do. So in this case, teaching empathy could be best again maybe by showing.
Exactly.
That's all my comment and what I can share. Thank you very much.
Zabidi?
Yeah, exactly. There's nothing like them seeing, things, and that is the most powerful lessons that they have. When I presented a similar paper in Taiwan, I was criticized for trying to preach people to be good, all right? But you don't want people to be in a certain homogeneous group of being good and so on and so forth. My answer is you don't want to teach people to be crooks, do you? We don't have universities to teach people to be bad, all right? We teach people the right way of doing things, that they will do the right way, you know? So we teach and we impart knowledge, but whether or not they will be good or not, that depends on them, you know? So I think but we have to make all the opportunities available for these things to be learned by our students. And I think the fact that your sons and daughters do emulate what you're doing is a very indirect way of learning and more powerful than them reading about it in the books. I think Angelica has some comments.
Thank you.
Professor Zabidi, I'm very much impressed and fascinated with your presentation, not only in its content, but more so on how you deliver your presentation. Now, being a medical doctor and having read a lot of literatures about this empathy, about what we call the fMRI. I would like to know your personal stand about this fMRI. Is it really effective, or does it really prove that a person has no empathy, or should there be more studies to see the effectivity of fMRI?
I think the technology has gone from gross view of the brain into a more detailed view of the brain using various modalities, previously radiation, now magnetic field. But I think that is not enough. I think in future people will go into the cellular level and see what's happening at the cell level and so on. But that is a state of knowledge we have now. There is a state of knowledge we have now that fMRI may have its limitation because it's based on seeing how the blood rushes to an active area. All right, that's how we see things, we visualize things now. That may change in the future, but currently that is the technology we have. That is the technology we have, and it looks like that technology we have doesn't defy logic. It does actually fit in with the science that we have.
Follow-up question.
Yeah.
So, if there is a substance in your readings, were they able to identify the particular substance that causes the lightening of, in the certain portion in the brain? Because if that is so, I'm thinking about genetic engineering, wherein, pairing of, you said when you're happy, there is a change in the DNA, no?
Yes.
That the pairing of
Yes.
the adenine, AT and GC, adenine and cytosine. So I was thinking if they have ever identified that particular
Possible. It
substance.
is possible to change. It is possible to change, and this has to be very, very carefully thought of, because if it is possible to change, can we then program somebody to be good, which is good, but can we then program somebody to be bad through a certain stimulation of the brain? All right. Now you remember one of the Stephen Hawking's prediction, I think it was a month ago. People asked him what does he think will be the end of the world, what mechanism, and he said that the over explosion of artificial intelligence. He did say that. In his prediction, in his mind, an over explosion of artificial intelligence might just destroy us. I think you're probably leading to that, because once you can make the brain in such a way that the person goes bad, then maybe that would be something that we have to be conscious about. Yeah.
Yes, Ronnie?
Sir, thank you for the presentation. Actually, one of our advocacies in our NGO is also breastfeeding. We run community healthcare clinics around the Philippines. So I'm sending the picture to my boss. So hopefully I could have a salary increase when everything to the business. I'm just kidding. So, sir, question. There are medical proofs that we could gain empathy, right? Based on your
From what we know so far,
yeah. Hypothetically, are there also medical evidences that empathy could be lost through lack of nurture, I guess, or what happened?
By inference, yeah. By inference. People who've done studies on the background of these people, who are I don't have that. I have on a different slide. There was a small community of convicts in Malaysia where this study was done, and the background of it usually very, very similar. The background of those who are convicted of certain crime, the background is often very, very similar in terms of nurturing and parenting and all that. Very similar.
Thank you. So I have one question from Turkey, from Zara, one of our students, who's teaching medical school in Turkey. She said, how can we stimulate empathetic behaviors in medical students, and which practices can be used for education to utilize what you've learned? And is there an age limit for developing empathetic behavior?
Yeah. The traditional way of trying to impart empathy to our medical students is in the early years we give them lectures, we ask them in exams, we give them case scenarios, and without case scenarios which is just at one level. They just have to have a look at the case scenario and answer them correctly, right? It's not as though we give them case scenarios and let them go into deep thinking, no. Over half an hour we give them case scenario, we expect them to answer. But I think that should change now. That should change into more involvement of the students, you know? More involvement. In fact, one very, very good reference you should try and have a look, Zara, is a recently published a documentary on doctor's profession, published by Al Jazeera. It's a 47-minute documentary. Al Jazeera produced a very powerful documentary on training of doctors in McMaster's University, Canada. And here they have a 4-year training program, but even in the first year, they put these young first-year students right in ICU, in intensive care. All right? They have removed lectures now, you know, because they feel that putting them in that environment and having discussions and reflections and so on is a much more powerful way of training them, right? So I feel that we should go through that pathway now, not piling them up with a lot of lectures and multiple choice questions and PBL and so forth, but putting them in real life. Not many universities are brave enough to do that because people fear that they may not have certain theoretical knowledge. But I think that documentary by Al Jazeera in McMaster's really is very powerful way to say that that's probably is the way forward. Giving them exposure to real life experience and at the same time be guided on the core knowledge that they should have in their mind.
Okay, thank you very much.
Thank you.
Zara, do you want to say anything? You can speak.
Thank you for this nice presentation. I wonder, much of us academicians think empathy can be learned. It is something we can learn in our childhood, I think. And in medical school, we try to teach them empathy, but our medical students come into practice in the 3rd year or in the 4th year of their education. And this is a problem because they can't see the patients. We give them a lot of lessons from medicine, from ethics, but if they don't see the practice, they can't make empathy. Yes. Therefore, I think it's important that these medical students get in the hospital from the beginning of the 1st year.
Yes.
And thank you for the answers and all this. Thank you.
Thank you. I completely agree with Zara. I completely agree with you on that. Yeah.
Thank you very much.
Last question. IQ and EQ, sir. Could you measure EQ, emotional quotient?
Psychology wasn't there, yeah. There are ways to measure EQ. Yeah. Happiness index, now people are going to spiritual index, emotional index, all of this.